Hi there! In this video, we will be looking at when things go wrong during the embryological formation of the cardiovascular system, which ultimately leads to congenital heart disease. To better understand this video, we ask that you watch our embryology video if you haven't already. Before we look at the different congenital heart diseases, let's look at some of the signs and symptoms which would make us suspect the presence of a congenital heart disease. Neonates with congenital heart diseases usually present with poor feeding, failure to thrive, impaired growth, tachypnea, tachy meaning fast, and pnea referring to breathing, so therefore rapid breathing, respiratory distress, cyanosis, clubbing, polycythemia, which is increased hemoglobin in the blood, pulmonary hypertension, infective endocarditis, and cardiac failure. Right, so what exactly is congenital heart disease? Congenital heart disease is the malformation of the cardiovascular system resulting in structural defects that are present at birth. There are two main categories of congenital heart disease: a shunt and an obstruction. Let's look at shunts first. A shunt is an abnormal communication between heart chambers or blood vessels, where the pressure gradient causes a change in the direction of blood flow. Looking at a normal heart, blood flows from the right atrium to the right ventricle, through the pulmonary artery to the pulmonary circulation, into the left atrium, to the left ventricle, and out of the heart to the systemic circulation via the aorta. There is normally a higher pressure found in the left side of the heart compared to the right side of the heart. This is basically because the left ventricle needs to pump blood to the systemic circulation, and the pressure needs to be higher than that in the aorta. However, when there's a shunt, the direction of flow changes. Remember, blood always looks for the path of least resistance. Hence, blood naturally flows from areas of high pressure to areas of low pressure. Okay, let's get back to looking at shunts. There are two types: a right to left shunt and a left to right shunt. First, let's look at the right to left shunt. These shunts are known to cause early cyanosis. Cyanosis is the blue discoloration of the skin and mucous membranes due to low oxygen saturation. In right to left shunts, the abnormal communication allows deoxygenated blood in the right side of the heart to bypass the pulmonary circulation. Therefore, it doesn't get oxygenated. This deoxygenated blood enters the left side of the heart and is pumped to the systemic circulation, causing cyanosis. Right to left shunts include tetralogy of Fallot, transposition of the pulmonary artery and aorta, persistent truncus arteriosus, and tricuspid atresia. Let's first look at tetralogy of Fallot. Tetra means 4. This makes it easy to remember that tetralogy of Fallot is a combination of 4 congenital abnormalities, namely ventricular septal defect, aorta overriding the VSD, obstruction to the right ventricular outflow such as pulmonary artery stenosis, and right ventricular hypertrophy. Individuals with tetralogy of Fallot assume the knee to chest position. This compresses the abdominal vessels, which increases the afterload or resistance to left ventricular outflow. This, therefore, increases the pressure in the left side of the heart until it's greater than the pressure in the right side of the heart, which causes a temporary shunt reversal. So now blood flows from the left side of the heart to the right side of the heart and then to the pulmonary circulation for oxygenation. Next, let's look at transposition of your pulmonary artery and aorta. This occurs when the spiral formation of the septum doesn't occur, but the septum grows straight down, allowing deoxygenated blood from the right side of the heart to pass through the aorta into the systemic circulation, while your oxygenated blood from the left side of the heart passes through the pulmonary artery to the pulmonary circulation. Okay, now let's look at persistent truncus arteriosus. In persistent truncus arteriosus, the truncus arteriosus fails to split into the aorta and pulmonary trunk. This leads to one arterial trunk arising from the heart and provides mixed blood, oxygenated and deoxygenated, to the coronary arteries, pulmonary arteries, and systemic circulation. Lastly, let's look at tricuspid atresia. This is when the tricuspid valve is missing or abnormal, which results in blood flow from the right atrium to the right ventricle being obstructed or hampered. Now that we've finished looking at right to left shunts, let's look at the other type of shunt, which is the left to right shunt. This shunt is known to cause late cyanosis. In left to right shunts, blood is flowing from the left side of the heart back into the right side of the heart. This causes an excess of blood passing through the pulmonary circulation. Over time, this causes pulmonary hypertension. This high pressure that has developed in the pulmonary circulation causes a bypassing of the pulmonary circulation with a shunt reversal. So now blood flows from the right side of the heart directly to the left side of the heart, resulting in late cyanosis. This shunt reversal due to the pulmonary hypertension is known as Eisenmenger complex. Left to right shunts include ventricular septal defects, atrial septal defects, and patent ductus arteriosus. So, ventricular septal defects occur when the septum dividing the two ventricles doesn't fuse. On the other hand, atrial septal defects occur when there's an abnormal communication between the two atria, such as foramen ovale. Reversal of the shunt usually occurs in middle age, resulting in the onset of cyanosis. Now let's look at patent ductus arteriosus. In the embryo, the ductus arteriosus links the pulmonary artery to the aorta. This allows most of the blood from the right ventricle to bypass the fetus's non-functioning lungs and enter the systemic circulation. Shortly after birth, the ductus arteriosus closes and forms the ligamentum arteriosum. However, in patent ductus arteriosus, this closure doesn't happen. This means that oxygenated blood from your aorta is now able to leak back into your pulmonary arteries and back into the pulmonary circulation, causing congestion of your lungs. Now that we've finished looking at shunts, let's have a look at obstructive congenital heart diseases, which are acyanotic. Therefore, they don't cause cyanosis. These include coarctation of the aorta, tubular hypoplasia of aortic isthmus, and aortic stenosis or atresia. Let's first look at coarctation of the aorta, which is narrowing of the aorta. This narrowing results in proximal compartment hypertension. Clinically, coarctation of the aorta is identified by radiofemoral delay. This is when the femoral pulse is significantly delayed compared to the radial pulse, when normally they are in sync. Next, let's look at tubular hypoplasia. This is when there's increased collagen, which decreases the ability of the aorta to distend. As we can see, there's less narrowing of the aorta compared to that in coarctation. Finally, let's look at aortic stenosis and atresia. This occurs when the edges of the aortic valve fuses to form a dome. As a result, the left ventricle works harder to pump blood through the aorta, and there will be left ventricular hypertrophy. However, aortic stenosis is when the lumen has been narrowed as a result of the valve fusion. while aortic atresia is when there's a complete obstruction due to the valve fusion. Before we end this video, let's have a look at a quick summary and do a quick recap because this was a very long and complex video. Congenital heart disease is the malformation of the cardiovascular system resulting in a structural defect present at birth. It can be divided into shunts and obstruction. Shunts can be divided into right to left shunts and left to right shunts. The right to left shunts include tetralogy of Fallot, transposition of the pulmonary artery and aorta, persistent truncus arteriosus, and tricuspid atresia. The left to right shunts include ventricular septal defect, atrial septal defect, and patent ductus arteriosus. Obstruction includes coarctation of the aorta, tubular hypoplasia of aortic isthmus, and aortic stenosis or atresia. Remember, right to left shunts present with early cyanosis. Left to right shunts have the Eisenmenger complex, which is the shunt reversal, and they present with late cyanosis, while obstruction is acyanotic. And that's the end of the video. Thank you so much for watching. We hope it helped you understand congenital heart diseases a little bit better. Please be sure to do the quiz on heart pathologies. The link will be in the description below.